In this capture, we will take a look at some different GI treatment modalities. We're going to start with GI intubation, and here we're looking at nasogastric tubes or orogastric tubes. You want to keep in mind the terms lavage and gavage. Lavage, L, leaving. This tube is put into the stomach through the nose, and it will be hooked up to suction. It's to suck things out, to make things leave the GI tract. And the most common ones that you will see are your Levin tube or your gastric sump or your Salem sump. We also have enteric tubes. Gavage, we're going to be giving something to the patient. So these are things that would be used for tube feeding. So moving from there, enteral feeding. This is something that was reviewed in Foundations. The skill was taught. If you don't kind of remember what went down, you want to make sure you take a look at your ATI Fundamentals book. If you still have your ATI skill modules, you can be looking at that. But if you think about the types of enteral feeding that we can give bolus feeding, which is depicted in your picture to your left, and we can give pump feeding, which is depicted in the picture to the right. The enteral feeding quick sheet, which those of you who come from 180 should have from last semester, I did also repost that on Plato this semester in the Unit 4 folder. If you don't still have that, or if you need it, make sure you get that out. It has a lot of quick tips for managing enteral feeding, a lot of safety things, and that information, it is foundational content, but it is fair game on both exam and quiz questions. So I would recommend looking over that. Just a couple highlights that I really want to point out. Of course, you're always administering the feeding at the prescribed rate and method, but according to patient tolerance. Make sure your enteral feeding formula is at room temperature. The other thing you need to look at is the administration of free water. Sometimes this is ordered by the physician, and it'll be, administer 100 milliliters of water, Q4 hours. But you're going to be giving water before and after each medication and each feeding. Before and after checking your residual, and in general every 4 to 6 hours, or whenever the tube feeding is discontinued or interrupted. This free water is really important because your feeding formula is very hypertonic. So when that gets into the GI tract, if you're not giving periodic free water, that hypertonicity is going to cause the fluids to shift in the body, and fluids are going to shift into the GI tract to try to balance it out, try to make it not so much hypertonic. That will cause a lot of abdominal cramping and pain. It'll increase peristalsis, and your patient will likely experience diarrhea. As a nurse, you need to maintain the delivery system as required. You need to think about avoiding bacterial contamination. If you have an open system, you really should only be putting 4 hours worth of feeding in your open system. Checking residual is going to be very important. It's one of those indicators that tells us how well this patient is tolerating the tube feeding. So gastric residuals should happen before intermittent feedings, and then depending on facility policy, every 4 to 8 hours during continuous feedings. Also, don't forget safety. The head of the bed should be elevated 30 to 45 degrees during feeding and for at least 1 hour after the feeding has been completed. You always want to be concerned about the potential for aspiration. We're going to switch gears and go from enteral, which means inside the GI tract, to parenteral, outside the GI tract. So when we talk about parenteral feeding, and these concepts are really important because they'll come up again when we get into Unit 6. But parenteral feeding is essentially IV feeding. It's a complex mixture. It has proteins, carbs, fats, electrolytes, vitamins, trace minerals, sterile water, sometimes some insulins in there. But it's all mixed together in a single container, and it is administered via the IV route. Generally, it is administered through a central line, and that just has to do with the concentration of carbs in the formula. It is not tolerated well in a peripheral line. Generally, we're looking at a PICC line or some sort of central line. So for patients in the hospital on parenteral feedings, they're going to get vitals every 4 hours. We're also really going to be watching their blood glucose. These patients are very different than you and I in the sense that when we eat something, our blood sugar is going to go up temporarily and then it's going to come back down. It'll go up with the next meal and then come back down. These patients have a continuous IV infusion of a glucose-containing solution. So their sugars are going to be up constantly. So it's really important to watch that blood glucose. If they're on parenteral feeding and they're NPO, generally we're checking their sugar every 6 hours. Sometimes as we're weaning somebody from a parenteral feeding and we start them on oral feedings again, they'll check them just like we do any other patient, AC and HS. But as a nurse, you need to watch for signs and symptoms of both hyperglycemia and hypoglycemia. Also, this should always be given on an infusion pump. This is not something that should be given by gravity under any circumstances. Flow rate should not be increased or decreased rapidly. And if your fluid runs out, the TPN bag gets changed every 24 hours. If it's not there to hang, you can't just take the old one down and let it go. You need to hang a 10% dextrose solution. That is to prevent acute hypoglycemia. The other thing you need to be concerned with is fluid balance. We have a large amount of fluid, generally 2 to 3 liter volume, infusing in the patient directly into their veins over a 24-hour period. That can put somebody into fluid overload. So assessment of their lung sounds, looking for edema, looking for jugular venous distension, watching their intake and output, watching their weight is going to be really important because we don't want this patient to go into fluid overload. The other big issue with these is because we're working with a central line, a CVAD, central venous access device. That is a direct portal of entry into your patient's bloodstream. Plus, we are infusing a solution that is high in carbohydrates. So we're looking at the perfect storm for a potential infection. So it's really important that sterile technique is used when working with that CVAD. When the dressing gets changed, it's a sterile procedure. When you scrub the hub, you are scrubbing for 1 full minute, vigorously. Okay, so technique is going to be really important. Again, there was a parenteral nutrition quick sheet given out in 182. Those of you that are continuing on, if you still have that, pull it out. It's a great reference. You're going to want to use it for this unit. If you don't have it, need another copy, it is posted on Play-Doh. Again, it would behoove you to look at that for both the quiz and the exam.